Hi, this is Mr. Williams with me. He is almost 80 years of age, had some breathlessness, and medical tests had shown that he had a severely calcific narrowing of the aortic heart valve, which guards the flow of blood from the heart to the aorta. And this obstruction had made the left ventricle get very thick and the muscles start getting tired. The heart was dilated and thickened due to a pressure overload. And on top of that, he also had a disturbance of his heart rhythm, atrial fibrillation. This can cause a sudden problem to life because of sudden lowering of the output of the heart, and it required a mechanical correction by surgery. This was not a problem which could be possibly managed with medicines. We have done for him an aortic valve replacement using a tissue valve made up of bovine pericardium, and also done a maze using a self-irrigated bipolar radiofrequency ablator, which was disposable. His rhythm is waxing and waning between normal sinus rhythm and atrial fibrillation. His heart is now doing well. He's undertaking a journey back to Chicago today, and we hope he will do very well. So here is Mr. Williams. Thank you.
I'm William Wilford Stutzman from Kyoto, Iowa. That's about central United States. We flew from Chicago. We came here to correct a heart problem that I had. Learned about the hospital here, the work that's being done here, through the internet. There were several factors in the decision to come here, and one of the great ones was the cost involved, because the entire cost here of the operation and all the procedures have been about 10% of what they would have been in the United States. We learned about this hospital through the internet, and then I talked to some other of my family members, and they checked out what they could too, and found that this was probably the best hospital, they said, in India. I would say that we've really enjoyed our stay here. If you can enjoy a stay in a hospital, maybe you can't do that. Not many of us like to spend much time in a hospital. But we've enjoyed the stay here because we've had excellent room service and excellent care in the room. Excellent doctors, Dr. Jawi, who's the head physician. We've learned to really appreciate him, and it almost seems like he's one of the family too. Also, as far as the nurses are concerned, we've had excellent nurses, and in fact it was almost tearful to leave some of them because they were a part of the family. We appreciate so much the work that's been done here in the hospital, and what work that is being done, and hope that it will be beneficial to a lot of other people too. As far as the technology, I think they have all the needed technology to handle any situation, especially they have in my case a very severe heart problem that they have corrected. I appreciate that so much. One of the reasons I think is it's superior in many ways to the United States. We may have more recent technology in the hospitals, but I appreciate so much the individual care given, where it's not only the procedure that's done, but also the concern, because I was told that there were 4 doctors who were attending me 24 hours a day during that time in the ICU. And I appreciate very much that a person can commit your life into hands like that that are reliable.